Vice Chair, no HES members have shown up in person yet.
Okay.
And we don't see any others on the line. But if you're any public speaking committee members, if you're on the line, you could let us know, appreciate it, because there are some numbers that show up. And Delegate George Toth is present in the Vienna conference.
The only ones who run the meeting.
Wonderful. Good morning, Yat. Hey, Mr. Toth.
Hello. On this Twin Arrow Day.
Oh, no, taga. No, taga, not at Twin Arrows. I've come home and going to be getting ready for a meeting tomorrow with all of my delegate region, as well as programs and divisions and then people. So yeah, but I understand today they're having the non-LGA certified chapter training in Twin Arrows. So I believe some of our colleagues might be still there to participate in that. Oh.
Yeah. Well, you going down coffee? Yeah.
Vice Chair Simonson, we have told the presenters that we asked them to provide the presentation in Zoom. That they all the members will have access to the PowerPoint.
Okay.
And I've been sending them by email as well, as soon as I get them.
Okay. Yes, I believe I've gotten at least one from General Services. I received that one, and then that seems to be like one presentation for the whole all their programs. And then I got the one from ODAC, and that's specific to ODAC. And then I don't recall if we got one for Head Start for the time they came before us. But yeah, so that's what I received. I can check my email again if anything new came.
Head Start did provide a binder with information about the schools and so forth last week, Tuesday.
Okay.
Chair, Vice Chair, we have Helena Nez, we did also minutes. We have one caller, 1505, last three number 115. Please identify yourself.
I think you've been out to, the good meeting. Make sure you're on the game.
What small? Just give me a grande.
Yeah. When you start, go ahead. Go. Mhm. Mhm. Mhm.
Sure want to rely on what.
Mhm. Mhm. It is. Do that. Mhm. Well, let me do problems in there. Yeah. Yeah. Yeah.
Good morning, Madam Vice Chair. We have 3 members present. Good stuff. There's 4, so we have a 4.
Great, thank you. Thank you for the information. Thank you and good morning to my colleagues on the 25th Navajo Nation Council. Good morning, Angelita and Miss Karen. Thank you for taking care of us this morning for our special meeting that we have scheduled for today. I'm going to go ahead, since we have a quorum now, I'm going to go ahead and get this meeting going. Our chair is en route back home, and he's not asked me to take care of his gavel today for this meeting. So members of HES committee, I would like to call this meeting to order. And if I could please get Ms. Benali to do a roll call, I would appreciate it.
Morning, Vice Chair. And members of the Health Education Services Committee, you have your roll call for the Health Education and Human Services Committee, special meeting March 29, 2023. And we're meeting in the Budget and Finance conference room. Delegate Helena Nesbitt, present. Chair Vince Gaines. Chair Vince Gaines. Delegate Dr. Amy Ness.
Present.
And Vice Chair Jermaine Simonson.
Present.
Delegate George Toth.
I'm here.
Delegate Curtis Yanito. Delegate Curtis Yanito. Madam Vice Chair, we have 4 members answering roll call.
Okay, thank you, and that calls, that is sufficient for a quorum. So we have here our special meeting here today, March 29, 2023 at 10 a.m. I'd like to call on my sister, Miss Helena Nesbitt, for an invocation to get us going here. Shade, ashne kwa asal doesn't klape na khahadizi.
Okay. Dear Heavenly Father, thank you for this day. Thank you for bringing us here today and to do our meeting and to talk and plan and work with one another and to complete our agenda and help us with our meetings and guide us and lead us in the ways that we go for our nation and be with my colleagues and everyone that's here, that's making their way here today, and give them a safe travel to, and be with us today, in Jesus' name,
Oh, thank you, Shade, for that prayer. And I'm certain we will have a some very good and discussions today. Though announcement, if any of our HES members have any announcements at this time, go ahead with your announcements.
Good morning, Madam Vice Chair, Mr. Tolkien.
Oh, go ahead, Mr. Toll.
And then good morning to all of our HEHSC committee officers. Just wanted to inform education department that tonight at 6:30 there's a meeting in regards to Yazi Martinez space. This is going to be held at Cuba High School. So if you're interested, you need to go, especially HEHSC committee. I'm heading that way. I like to get excused at 3 o'clock, so I can go down to Cuba to sit on that meeting. Maybe I just want to bring that out. If the pastor wants, committee wants to go to you, and then this is a late notice. Yeah, thank you.
Oh, thank you, Mr. Tolf. Other members of HES committee, Ms. Helena Nesbitt, Dr. Andy Nez, do you have any announcements?
We just had that meeting with the veterans on Friday at Twin Arrows.
Okay. Yes, we have the they're calling it an orientation for Friday at Twin Arrows from, I believe, 8 to 2 p.m.
Mountain Standard Time, remember that.
Okay. Thank you, Miss Helena Nesbigay. Any other members with any announcements? Going once, going twice. And I'm going to go ahead and move on to number 2 of our agenda, our proposed agenda, recognize guests and visiting officials. Would any of my HES members like to recognize any visiting guests or officials at this time? And any of the colleagues maybe that got on the phone, would you like to recognize guests or visitors at this time?
Mr. Cole, don't we have anybody except the presenter up here?
Okay, so recognizing all the presenters that actually that are there in person, thank you for being in person. If there are no other recognitions, I'd like to move on to 3, review and adopt our agenda. I'm going once, going twice, and I'm going to go ahead and move on to number 3, review and adopt agenda. And if I could, before you is the proposed agenda. I'd like to ask Miss Karen Thompson to see if, can you go ahead and do a reading of our proposed agenda? And then we'll go ahead and get a motion and a second on it.
Yeah, thank you, Madam Chair, this is Angela Benelli.
Go ahead.
You have your proposed agenda for the Health Education and Human Services Committee, 25th National Council Special Meeting, March 29th, 2023 at 10 a.m. Presiding the Honorable Ms. R. James, Chairperson, Honorable Committee Simonson, and Vice Chairperson. Place at the Budget and Finance Conference Room. We also via telecommunications when you're off now, Arizona. 1, calling to order roll call invitation announcements. 2, recognize guests and visiting officials. 3, reviewing and adopting the agenda. 4, reviewing and adopting the journal. March 15th, 2023 as a regular meeting. 5, receiving reports is an orientation overview. A is the Division of General Services. An overview of the VGX Plan of Operation Organization Program, Strategic Plan, etc. Presenters are Mr. Sean Dale, Executive Director for Division of General Services, and Marcus A. Yazzie, Senior Planner for Division of General Services. The programs are the Administration, Air Transportation, Department of Information Technology, Employee Housing, Facilities Maintenance Department, Fleet Management, Insurance Services Department, Navigation, Telecommunications and Utilities, Records Management Department, and Closing. And the respective managers are listed next to each of the programs. B, the Department of Dene Education, an overview of the Dene Education, Department of Dene Education, Plan of Operation, Program, Strategic Plan, etc. Presenters are Dr. Harold Begay, Superintendent of Department of Dene Education. Also, Claudia Edgewater, Deputy Superintendent for DODIE. And the programs are the Administration, Office of Dene Accountability and Compliance, Office of Standard Curriculum and Assessment Development, Claudia Navajo Nation, regarding the NCAA accreditation, certification, and assessment. Office of the Special Education Rehabilitation Services, Office of the Navajo Nation Scholarship and Financial Assistance, Office of Dene Youth Development, the Navajo Nation Library, Office of the Main School Improvement, the Office of Educational Research and Statistics, Navajo Head Start, and the Johnson and Alley Program. And the respective program managers are listed aside with each of the programs under DODIE. C is a report presentation by Western Sky Community Care. The report will be concerning provided services in Arizona and New Mexico, managed care for health insurance for Medicaid eligible individuals. Presenters are Lane James, provider specialist, 3, tribal liaison, Lujan, Director of Tribal Relations, and Filipino Supervisor of Tribal Program Development, Shayna Ramon, Service Executive for Welfare. all of the, individuals are with Western Sky Community Health Care. 6, old business none, 7, new business none, 8, close of meeting, announcements and adjournment. And the next meetings, are as indicated on the agenda. Madam Vice Chair?
Thank you for that, Ms. Benali. And if I could get a motion and a second on this proposed agenda? Okay, Ms. Helena Nesbegay motions, and can I get a second?
Mr. Toll, second.
Mr. Toll, so thank you for that second. And do we have any amendments to this agenda?
Delegate Nance, I have an amendment.
Oh, go ahead, Dr. Andy Nez.
Thank you, Vice Chair. So to the motioning party, I would like to amend the agenda and ask that item C, report presentation by Western Sky Community Care, be under our 5A for receiving reports. So it would come before the Division of General Services. They are here present in the BNF conference room and are prepared and have made the trip to be with us this morning. I appreciate that. Into the motion party, I would make that as the first amendment. The next amendments are really just for clarity. Under the Western Sky Community Care, I wanted to include here, let's see, wait, let me just double check. Mr. Gene Williams, CEO, and Care First Arizona Complete Health. The Shayna Yellow Hair Flores include Alberto Ashton and also Amy Devins. And also under item B, Department of Divinity Education, Claudia Edgewater. I know I mentioned this last time, it's assistant superintendent, not deputy superintendent. Also under talking and nomination, NCA accreditation, certification and assessment, Patricia County Principal Ed Specialist is no longer with the Department of Divinity Education. And those are the amendments at this time. Vice Chair.
Okay, thank you. Thank you, Dr. Andy Nez. I'm going to go back to the motioning party, Ms. Helena Nesbegay. Is that, do you agree with the amendments?
What do you think? I guess.
Okay. Only question I have, Dr. Nance, is general service presenter stuff. General service presenter. Okay. All right, I second. Concur the changing.
Okay, yes, go ahead.
I have my day.
Okay, so what I'm hearing, I'm sorry, what I'm hearing from Shada Helena Nesbegay is that you're in agreement to the amendments that Dr. Andy Nez has put before us. Can Ms. Benali just review that just for clarity for everyone here?
Yes, Madam Vice Chair, this is the second reading for the approval of the agenda. There's one amendment that was offered and agreed to by motion parties. And that's to under 5C, is to move 5C to 5A. And then 5A will become 5B and 5B will become 5C. Also under the Department of Divinity Education to delete, under Claudia to delete Patricia Goddard, he's no longer going to delete. And also to add 3 more individuals under Western Sky Community Care. And I will indicate those names on the final, final listing on the agenda. I didn't catch all of the exact names, but I'll get them from Dr. Ness, Madam Vice Chair.
Okay. Okay, thank you for that, Ms. Benali, and that helps clarify what our new agenda will look like. Otto, are there any other amendments to this agenda? Going once? Going twice? And we will, so it looks like we've got just the one amendment from Dr. Andy Nez, and we'll make those changes. And let's go back to the, we're going to go back to the motion to adopt this agenda. And I'm asking my colleagues to, let's go ahead and vote on this new agenda that is before us. Ms. Angelita Benali, can you get the vote count, please?
Yes, Madam Vice Chair. Delegate Helena Nesbitt, how do you vote? Green. Thank you. And Chair Vince James, are you on the line? To approve the agenda? Delegate Dr. Andy Ness, how do you vote?
Green.
Thank you. And Delegate George Toth, how do you vote?
In favor, please.
And Delegate Curtis Udito, how do you vote? Madam Vice Chair, you have 3 members who vote in favor and 0 against, and Vice Chair not voting.
Yes, thank you, Ms. Benali. And with that, we'll go ahead and go to the new agenda that is before us. And then you've already sort of clarified for us again, but do we need to review the, do we need to do another reading of the agenda again?
Madam Vice Chair, the agenda has to be adopted.
Okay.
Yeah, a third reading isn't necessary unless there's a question about the agenda, then I can provide a third reading.
Okay, and with that, we'll go ahead and adopt the agenda, and we'll go ahead and go forward to item 5 on receiving reports. I just want to let the presenters know that the format that we have, and it looks like you received that instruction on the orientation overview, is you're just basically giving us a summary of your program, the challenges and timeline of your solutions. And then just, you know, in respect to the different agencies that you either cooperate with, or and perhaps you provide information to. There's, oh, I'm sorry. I'm getting ahead of myself here. Let's go back to action 4 on the agenda, review and adopt the journals to March 15, 2023 regular meeting. You should have gotten in the email the journals from that time. Can I get a motion and a second on those journals?
Motion is Dr. Ness.
Dr. Nez motions to adopt the journal. Do I have a second? Okay, and Ms. Helena Nesbigay seconds that, and I'm asking colleagues to vote. Mr. Toth, how do you vote on reviewing and adopting the journals?
I'm in favor, Madam Chair. Bye.
Oh, Dr. Andy Nez,
Green.
green. Ms. Helena Nesbigay,
Green.
and do I have a vote from Chair Vince James?
Very land, so
Mr. Vince James? Can I get a response from Mr. Yanito? How do you vote on? Mr. Yanito? And so we have 3 in favor and chair not voting, and that is the adoption of the journals. Okay, so we're gonna go ahead and move on to receiving report. I was was in the process of reviewing what that looks like. And I believe I covered, so we give each program and department how we would like to receive their report. We give 20 minutes for the report. And we're actually, we know there are issues, but certainly we're looking at how those issues will be resolved. And so that's what we're mainly interested in. I just want to mention to my colleagues that we have so General Services is the first time that we're hearing from them. And then Department of the Education, in different respects, they've come before us with different HEHSC meetings, whether they be providing a report on one thing or another. And last week, we heard from them extensively on the Head Start program. So, we just need to keep that in mind, that we also presented some questions for the Head Start program that we ask for, response back within the 30-day grace period from Dr. Harold Begay. So just keep that in mind, that as we go to our questions after receiving the report. So please jot your questions down as while we're hearing the reports, and we'll make time for that. So according to our agenda, we said that we would move Western Sky up to 5A, and I believe they're in the building. And so if you could bring your presenters before the group, and we'll go ahead and tell us when you're ready, and we'll get that 20-minute timer going.
Question, Vice Chair. This is Doug.
Oh, go ahead.
So I know that Western Sky as an external entity, and prior to their introduction, I know you went through the orientation review. My understanding is that is applicable to our tribal departments and programs, but I did want Sky to address that if they'd like, but I know their specific presentation is not subject to the orientation review. I just want to make that comment. Thank you.
Yes, thank you, Dr. Andinez. I was going to go ahead and I forgot to mention that they aren't one of our programs and divisions, so their format is will be a little bit different, and more so providing and educating us on what Western Sky Community Care is and their goal and objective, if we're in agreement to that. So with that, if there's no other questions, we will go ahead and start with our presentation. And remember, you have 20 minutes for your presentation. And members of HEHSC, if we feel like we need more time after the 20 minutes, we can always make that we can always make that change. And I give you the floor, Western Sky.
Madam Chair, all members of the Health, Education, Human Services Committee, Wheatfields, Arizona, Western Sky Community Care, Provider Relations Specialist too, should know,
Watehopa. My name is Eric Lujan. I'm Director of Travel Relations for Western Sky Community Care. I come from Taos Pueblo and Okeowenge. Thank you for having us.
Good morning, Sheena Yellowherd and a chef at Kabahanishlan. Originally from Chinle, Arizona, and I am coming from Phoenix, Arizona today.
Good morning, Amy Devens with Arizona Complete Health and Care First. I supervise our first responder services and urgent engagement teams for our crisis system in Arizona. And I'm coming to you from Sarita, Arizona, very far south.
Madam Chair, we have a PowerPoint presentation on the screen. I believe we're screen sharing and I'm hoping everybody can see it. Can we get some confirmation that it is visible? I think it is.
Yes, it is.
Okay, yeah. I know we're allotted 20 minutes, so we will split the presentation between New Mexico for 10 minutes and then also Arizona to Shayna Flores and her colleague for the last 10 minutes as well. So again, Western Sky Community Care, we partner or we pride ourselves on transforming the health of our community one person at a time. Today, our main areas of focus will be just an overview of who we are, provide information about member services, the value-added services that we provide for our members on the New Mexico side, the public health emergency unwinding, how we're going to roll that out for our members in New Mexico.
Sorry to interject. Did you, I apologize.
No.
Did you send it to us, the presentation? I don't have the presentation.
It's on Zoom.
We have copies of this.
No,
For Care First.
Oh, we have to do. Then use their shared.
Is it on Zoom?
We'll set this one up. Just a couple minutes.
Okay. And then just for clarification, Dr. Nez, I also emailed you a copy because you're the only one I had an email address for the committee. So you should have a copy to you. And then I don't know if you want to share that with your colleagues as well.
Yeah, put it on. We'll send it.
Not getting.
Sorry. She's no longer with Western Sky. She's not here with us. She's with WellCare. I emailed you the amendments that Dr. Nez proposed. I apologize for not including you in that original email.
I would ask the presenters to go ahead and continue. Your time is clicking.
Oh, just proceed then.
No, stop the recording.
Madam Vice Chair, this is Angelina Benelli.
Recording in progress.
We had to get their presentation up. So
Okay,
your time hasn't started yet.
okay.
We called IP over.
Okay. Okay, well, yeah, I'm seeing it on my screen over here, and I know you all are in person, so you don't have the screens up. Okay.
We have it too. We're good.
You have to.
We're okay.
Okay.
You don't want to have your screen? No.
No.
I just want you to do.
Yeah.
Recording in progress.
We're good? Okay, Madam Chair, I think everybody has a copy of the presentation here within the conference room, so we'll go ahead and proceed with our presentation.
Okay, Go ahead.
And also members in the gallery here. Again, today, we're going to cover just an overview of Western Sky Community Care, an overview of the member services that we provide for our members on the New Mexico side. Also, the value-added services that we provide for our members. Probably one of the most important ones is the public health emergency unwinding on the New Mexico side. As the public health emergency is narrowing down, we anticipate losing many members to the Medicaid program. We will share with you kind of a roadmap of how we will be dealing with that. Also, we'll overview care coordination and behavioral health, and also our tribal relations department. And lastly, our contact information. Just a little bit about us. Western Sky Community Care is part of is a subsidiary of a larger group called Centene Corporation. And as our Arizona sister organization will show you as well, they are also, we are all under Centene Corporation out of St. Louis, Missouri. We have over 30 years of experience in managed care that we focus on. Again, we're committed to helping people live healthier lives. Member Services has a team of people ready to help the members today. On your PowerPoint presentation, you'll see a copy of our Medicaid card that is very informational for our members. For our members to provide an identification card, each member should have a copy of this card, and it has all of our key contact informations there that they can reference to schedule anything from non-emergency medical transport, help them navigate through the portal on our website, and also to file a grievance or appeal. One of the biggest things that our members benefit from, aside from the care coordination behavioral health, is the value-added services that we provide at Western Sky Community Care. And I won't go through each and every one of these. Again, you should have a copy of the presentation. If at any point you want a more in-depth presentation to this, just feel free to reach out to us. But one of the most popular ones is our Native American traditional healing benefit that we provide our members. It's basically intended to provide and assist members with traditional healing services. However, we do not require any type of receipts or any information back to us. For Western Sky, we provide our members with a $250 Visa check card that's basically utilized in every area. So the next two slides are just basically an overview of the value-added services that we provide. Okay. Care coordination and behavioral health is really what we give support to our members in order to live the healthiest lifestyle possible. It's very useful in a lifelong illness like asthma or diabetes, if our members have special needs, or if they have behavioral health needs as well. If they need home care or community-based services and are using self-directed care community benefit services, or have any type of physical or developmental disabilities. Care coordinators are basically the backbone of our program. They provide all the services to each individual member, anything from scheduling an appointment or providing non-emergency medical transport. Really all this for care coordinators, the most important thing is to provide a health risk assessment for each individual member, and that really opens the floodgates of services that we provide for our members. In reference to the public health emergency unwinding, as you all are aware, that New Mexico and throughout the country, there's I guess a move from the public health emergency with COVID. And in that, we have some state resources that are available there that will show you how the state is really partnering and looking at the unwinding process. Below that is our plan and the resources that we at Western Sky Community Care will be utilizing and really addressing the needs of those individuals that may be moving from Medicaid services to different services as well. We will be conducting outreach to each individual member that is under our health plan, both by mail, direct mail. We're gonna have a hardcore text messaging campaign, email, and also any community events within your respective community. I think Delegate Tolk, you mentioned that there was an event within your respective community. Any event like that, if you have in your respective community, you want us to come out, please feel free to reach out to us. That's what we're here for, and really to provide education to our members. Those that may be falling off of Medicaid, this is the plan that we will have. We will also conduct warrant handoffs of our members that are no longer eligible for Medicaid to our subject matter experts, and also health insurance brokers for our lines of business like WellCare, which is our Medicare program on the New Mexico side, and also Better for our marketplace. Again, any outreach within your respective communities, if you want us there to provide education, my contact information is there as well. This next slide is just basically our public health emergency unwinding, basically like a playbook that we will be having. We will have a one-pager sent to each individual member on how to navigate additional resources as they're unwinding from Medicaid. We will also, again, do the text messaging, the email messaging for our members as those that are falling off of the Medicaid program.
We will also be providing radio spots and have billboard presence along I-40 and a lot of the major highways around Navajo Nation. This is a larger education campaign in the state of New Mexico to really make sure not just our members, but all Medicaid members understand that they need to be on the lookout for certain materials coming out of the state of New Mexico that really is designed to help them understand what they need to do in order to maintain their healthcare coverage through Medicaid.
And really, it's a prevention of those individuals that may be falling through the cracks on services that are being provided. So very important stuff. Again, if you have any events in your community, feel free to reach out to us. Our care coordination, again, behavioral health for our member connections team. They're really trained, they can help, they're trained to find doctors, specialists, and other providers if an individual needs additional services beyond what we provide. If they need specialty care, that's what they're trained to do. They also, we provide community support services like food, shelter, housing, etc. And again, scheduling appointments, finding transportation for our members if they are being referred out to a specialty provider. Our tribal relations team are basically individuals that are Native American on the New Mexico side, Native American hired individuals within the state of New Mexico. I specifically am fluent in the Navajo language. We do have individuals within our team at our corporate office that do speak Navajo. If an elderly or somebody who has limited English proficiency request a Navajo speaker, we do have those individuals on hand as well. We do support members in understanding their benefits and services and provide culturally relevant resources. Just as an example, we recently had a Native American Advisory Board meeting that we do quarterly in the Gallup area on March 3rd. We had a member there with her daughter. However, there was a big communication gap between the two of them because the daughter did not understand Navajo. So we were there on hand to provide the Navajo interpretation of the services that we do provide. And it just so happened that the individual was both a member of our Medicaid program, also our Medicare through WellCare. So we have, unfortunately, we had our WellCare representatives there on site as well. And we helped them navigate all the resources that are available to her online and accessing those resources. So that's where we really pride ourselves, our tribal relations department, and our tribal relations department directly reports to our CEO as well. So again, our provider relations specialists, we are available to provide IHS and 638 providers. We do monthly calls with all of our IHS and 638 providers for those that are willing and are able to provide in these monthly calls as well. We do have currently a pilot project with Crown Point Department of Corrections. We have where individuals that come through the Department of Corrections are basically falling through the cracks and kind of having a revolving door for those individuals. For those individuals that are seeking help or that want help, have a partnership with Four Corners Detox out of Gallup to provide those services as well. So again, as health committee members, if you have any ideas within your respective communities on pilot projects, maybe you feel like there's a gap in some of the services that are being provided, not just by Western Sky Community Care, but other MCOs as well. If you feel like there are some opportunities out there, feel free to reach out to us because we do provide those services as well. So we really are open to suggestions. And lastly is our Western Sky Community Care Tribal Relations contact. Again, my colleague to my right is Mr. Eric Lujan. He's with the Taos OK Wingate community. We also have a young lady by the name of Leanne Saya. She's with Laguna Pueblo. Myself, Zane James, I actually work out of Window Rock, so I'm local. If you guys ever need anything, I'm basically just a phone call away, text message away, so do not hesitate to reach out to me. I will leave a card with you all. And also we have Craig Sandoval, who's a member of the Navajo Nation and Hopi tribe. And also Christina Lewis, she comes to us from the Laguna, Acoma, and Taos Pueblo. So we have a pretty core group here. We feel that covers all of our tribal members on the New Mexico side. Lastly is also our contact information, our member services number, our nurse advice line, our ombudsman. Ombudsman is very important because that's an independent individual that does not work for Western Sky, but also can address any issues that members may have. We're going to pull up Arizona's health presentation and share that with you. So if you can just give us a quick minute, and I'll turn the floor over to Shayna, and maybe she can just start with her overview for now, I guess.
Sure. Thank you very much for this opportunity to share this presentation time with our sister company, Western Sky. I'm here and Amy's here to give an overview, a very high level overview of Care First. As an organization, we do very much a similar service delivery as Western Sky, except for the Arizona portion of the Navajo Nation. So this fits very well to do together. We operate, we have a contract with Arizona Healthcare Cost Containment System, so ACCESS, to provide services for Medicaid eligible individuals in Northern Arizona. In addition to that, we're also the Regional Behavioral Health Authority with ACCESS as well. And where our primary objective is to provide crisis services as well for Northern Arizona. So now we have the presentation up, so we'll go ahead and I'll briefly go through some of the slides. So here's a snapshot of Care First history in Arizona, beginning in 2003 until all the way through 2022, last year, when we were awarded the North Reba contract for Northern Arizona. And here's our operating structure, and this is what Zane had alluded to as far as us being sister companies and also under Centene Corporation. We are a family of health plans in Arizona, and you'll see in the New Mexico side, Western Sky also operates as one of our counterparts as well. So very, very lucky to have that partnership. So we have a wide range of health benefits for individuals enrolled in Medicare, Marketplace, and Medicaid health insurance and our health insurance plans. And we currently serve more than 575,000 Arizonans across our plans. You'll see Care First is in the northern region in blue, and we have Arizona Complete Health and Complete Care Plan in southern Arizona, southern and central Arizona. Here are is a map of the tribes that we serve in northern Arizona, including the Navajo Nation. As far as the REBA implementation, this Care First was awarded this contract with ACCESS on October 1st of last year, and it was implemented on October 1st. And what that means is that approximately 6,000 Title 19 Medicaid members living with SMI were transitioned from Health Choice, the previous REBA, over to Care First. In addition to that, we are now, we also now manage the crisis response system for Northern Arizona as well. And we also have some grant funding also. And the majority of our presentation will cover the crisis system and what that looks like. So again, the REBA changes. We are the Regional Behavioral Health Authority for Northern Arizona. And what we cover integrated services for individuals with a serious mental illness. We operate state and grant funded services. We operate crisis services and also court order evaluations when contracted with certain Arizona counties. So previously, The REBA was Blue Cross Blue Shield Health Choice Arizona, and now it is Care First as of October 1st of last year. So what this means, in a nutshell, is that American Indians in Northern Arizona have a variety of options for their Medicaid insurance health plan, and we are one of them. They also have the American Indian Health Program, but we work closely with our tribes, IHS facilities, and tribal facilities to ensure that those American Indian members can choose which facility they receive their services from, regardless of which health plan they choose. And our experience in Arizona includes working with tribes in Southern Arizona, developing MOUs for crisis services, tribal crisis response protocols, co-locations of crisis mobile teams, which are some things that we'd like to possibly develop here on the nation as well. So I'm going to turn over to Amy.
Thank you so much. I'll move very quickly. I'm Amy Devens, like I said. So we've been working in the southern region of Arizona for a very long time. And in winning the contract in the north, we're very excited to bring our crisis service delivery model to the northern region of Arizona. Again, Sheena's already spoken to this a little bit. You could basically just swap those two middle boxes as of October 1st. I'll be addressing crisis service delivery specifically. I do want to mention that we moved to a statewide crisis line number, the 844-534-4673. The last 4 digits spell hope. Access decided it was a good idea to, instead of having 3 separate numbers, that we have one main number. All the old numbers still work though. They all ring into Solari, our single provider for the entire state. This is the slide that I really want to hit home. Crisis services are available to everyone. There is no disqualification. There is no insurance prereqs. There's no prior auth. Crisis services are delivered to everyone in the manner that they need. So telephonically, in person with crisis mobile teams, or observation units, 23-hour odds, community stabilization units, those walk-in sort of ERs that are specifically designed to be like an ER, but for mental health related issues. We have a no wrong door policy. So any of our providers, if someone walks in and says, hey, we need some help, we're not going to turn them away. We also operate, like I said, the crisis line, the crisis mobile teams, and those stabilization units. We develop contracts with our providers and have those providers ready to go. Community stabilization is a key factor for us. Philosophically, we want to make sure that we meet people where they are. So a lot of times people want to stay home. They want to do things by phone. They don't necessarily want to go someplace. They want to bring services out to them. So we believe that is probably a best practice. So that's how we model our crisis system. And then real-time escalation. There's always somebody on my team that's available 24/7. Through that crisis line, we make it super easy. We model and design the crisis system similar to how 911 and our law enforcement, fire, EMS folks operate, meaning you call, you always get someone who's going to answer. There is no wrong door. You say what you need, and we move on. I'll spend a moment on this slide. Crisis is designed for early intervention. There is no wrong door. We define a crisis as anything outside of a person's ability to cope. So that can be anything. We also work very, very hard on our revolving door usage of 911 or emergency services. Many of us on our team are former first responders ourselves, veterans. So we have that experience of trying to help folks and not necessarily having the best tools. So that's what we design our crisis system to be. We envision it as an emergency service that we will regard one day, just like we regard first responders. We host crisis system meetings, we write crisis protocols. So everything that we do, we want to make it as easy as possible, and simplify a system so that people feel more comfortable engaging. This slide really illustrates who our current providers are in this area. Sheena spoke to this a little bit about how we envision co-locating our crisis mobile teams. Drive time is always a barrier. So that would be something that we would love to explore, but the crisis line is ready to go. And with that, I will leave you with many of these slides because we have quite a bit of detail here. And I know we're running short on time. So with that, oh, I want to mention 988 very briefly. As of July 2022, nationally, we went to the suicide and crisis lifeline. That 800 number changed over to 988. One thing to be aware of with 988 is that it's not geolocation. It does not know where you are. It routes the call based on your phone number, so that prefix. So it's possible that you might get routed to a call center that isn't necessarily in the state that you're in, but to make sure to articulate where you're at, and they'll get the call routed there. In Arizona, Solari, that crisis line provider, is our crisis line provider and is the call provider for 988 as well. So we envision that there probably will be some stuff coming out to maybe do some geolocation on like cell towers, like phase 1, if you're familiar with 911 operations. But right now, that's something to be aware of, that you do need to message for folks if they're using 988, that we don't know where they are necessarily. We offer trainings. I'll leave them with you. You have our printouts. We offer a lot of this training. So we're happy to answer any of those questions.
Real quickly, you have this in your packet, just a history of our outreach to the Navajo Nation. Thank you.
Okay, thank you for that information. And I believe your 20 minutes is up, but I'm just going to go ahead and ask my colleagues if they would like to give you another 5 minutes to complete your presentation. Colleagues, are you in agreement to giving another 5 minutes?
Yes. Yes, Chair, Madam Chair, Vice.
Okay, and I heard from Mr. Tolth as well as Ms. Helena Nez. Dr. Andy Nez, do I hear an agreement to that?
You have consensus.
Okay, and then on the line, Mr. Chair Vince James, as well as Mr. Yanito, do I have your go ahead to give 5 more minutes? Going once, going twice. And I'm going to go ahead. I believe we have a consensus here, and I'll go ahead and let's give another 5 minutes to wrap up your presentation.
Thank you, Madam Vice Chair, and thank you, committee members. So going back to this slide is our history of our outreach and collaboration with the Navajo Nation, in hopes to bring this information to the committee and to leadership as well. And now we know here in 2023, we have a new administration, new council members, new committee members that we're hoping to work with and partner with, and to continue our efforts to meet with the Navajo Nation departments, and also possibly pursue MOUs for crisis services, and also a similar one as Western Sky after they have completed the development of theirs. But we're looking to possibly split that apart with crisis services to hopefully get something like that developed here in the north as well, in partnership with the Navajo Nation Department of Health and Department of Behavioral Health Services. You'll see which would include the implementation of on-site crisis mobile teams or crisis response on the reservation, and then the postponed coordination of care person members being released from Navajo Nation detention centers. So with that, here's our tribal relations contact information, as well as Amy Devens, our supervisor of crisis system and first responder services. Thank you very much.
Thank you again, Madam Chair, members of the Health, Education, Human Services Committee. Again, if you saw the presentation and saw the overview of it, as Centene Corporation, a subsidiary of Western Sky, Care First, and also Arizona Complete Health, we do blanket all of Navajo Nation on the Arizona and New Mexico side. So we're here to help. Again, thank you for your services. Also, congratulations on your recent elections, all of you, and also your new appointments to your respective committees. We do look forward to working with you, establishing meaningful partnerships. Nikit nas agi da hadret ada na nishjat ehu wato det no singo la na no singo nich auto netot ada bidnit factor ibn geikwa min kita in ko hands father. Thank you very much. And also not just those services, we provide additional services, especially from Western Sky as well. We do a lot of community events, community organizations. We do annual wood distribution drive in the Shiprock community. We can do that in other communities as well. So feel free to reach out to us.
Oh, uh, thank you for sharing all that information. That was quite a bit, and I'm going to go ahead and I believe if that concludes your presentation, I'd like to go ahead and Angelita, motion and second. Am I right?
That's correct, Vice Chair.
Okay, motion, can I get a motion and a second for this presentation? And then I'll open it up for questions if there are any from my colleagues. Motion, Jose? Okay, Mr. Nez, thank you for that. Hayla, can I get a second?
I'll second.
Thank you, Ms. Helena Nesbegay. We have a second, and I'll go ahead and ask my colleagues if they have any questions regarding the presentation before you. What is the lineup here?
Go ahead, Chair, Madam Chair.
Oh, go ahead, Mr. Tolson.
A few questions for the presenter. If you had for presenting your organization, I have some concern regards to, not concern, but veterans. How do you assist the veterans? What I'm talking about is the veterans needs help. And according to the veterans policy is that you have to dial certain numbers. And then they direct the line to different places. It takes time. Since you have 988, how fast can that, if somebody wants help, trying to suicide, have problems? I have a brother that passed on 2021, January, of being an alcoholic. He's a veteran. We try our best to save him. We call different programs, even the nomination, the program, but they would help. They always tell us, have him come in. And here the guy didn't want to go. So one day he came up to me and said, brother, I need help. So I took him to the hospital. You know how it is at the hospital, it takes forever. And we just walked out of it because we waited for so long. So those are some of the areas of how fast can a veterans or anybody that's in need of help to actually call this number and get assisted right away. You know our situation out here, way in the remote area. Elderly, some even our kids don't have a home, don't have a computer. And I guess the only people that benefit this is you have to live in town. You have to live in city, you have to live in like Winterloch. So that's the question I have. The other one is addition. How far do you go? If one of the client comes in that having help, I need a prayer done for me. You know, right now, the medicines, their prices going. So I know when used to have that, employees, especially employees, they have that kind of benefit. But I think that's, they've done away with it, so that's where my concern was. How far do you go? Do you actually pay the medicine man? Or do you go to the house, send them to the hospital? Those are some of the, we have a good program. But how can we use this right away? If our people needs help. Right now, you know? I've seen a lot of vehicle going around the reservation, hauling patients to clinic appointment. There have been abuse too. The nation needs to look into it. Because I saw, you know, numerous times I saw people, the caregiver hauling their family around to Walmart. Isn't that abuse? Who monitors that? I don't know, do you have a vehicle like that in place, a caregiver? The other one too is an elderly, that's a caregiver. How does this patient pay for it? Is it from their income? Like if you take an elderly to home care in Gallup, they deduct out of their social security the money income that they get. That's how they pay for it. But the service is pretty bad. The reason why I'm saying that, I worked for IHS for 15 years. Being security, next thing I know, you're not being a transporter. I transport patients from the hospital to the home care, like Gallup, Farmington, Gallup. And I go to these places. All you see is elderly in wheelchairs, man and woman. Anyway, some of them don't want to go. Some are, you know, saying that they've been abused by the other patient or even the staff don't care. My dad ended up in the hospital before he passed on. He stayed in there for 30 days. Oh my God. And when he came out, he says, I don't want to go back. Because the patient was fighting, throwing food at each other, silverware and whatnot. So I don't want to go. So those are some of the issues that I'm looking for. We have a lot of these programs that come, hey, we do service, hey, we help people. But when you need help from the organization, they give you a runaround, you know, just like IHS. If you're in pain, trying to tell the doctor, the nurse, pain's right here, just hold on, they'll start taking the temperature and all that. And you sit and waiting. So I know there's a lot of program that comes to us and they do service for the non. Right now, like the way I look at it is that the service gets rendered within the city, along the highway. What about way out there? Like a big mountain, Navajo Mountain. Janitors, visitors along the highway, so. I've been law enforcement for 25 years. I know that I'm talking about the back roads of, you know. So my concern is elderly veterans. How can we help them? So that's the only concern I have. And your question, I might be off the board, but as long as I feel good. Okay, thank you.
Madam Chair, Mr. Delegate, I'll defer to my colleagues from Arizona to answer the question about 988.
Okay. Thank you. Mr. Toth, let's go ahead and go to, I know, Mr. Toth presented a lot of, questions and comments. But I'm gonna go ahead and if I have another colleague that is in the queue to ask questions, let's do that. And then we'll go ahead and go back to Western Care for a response. Do I have other colleagues, for, questions or comments?
Vice Chair Duggan.
Oh, go ahead, Mr. Ness.
Attachment, so in addition to what my colleague here and will talk about, I am interested in learning the data as well. I know that you guys service a lot of our relatives, not only with the Caroline numbers, but also from New Mexico and Arizona. And the data, I didn't see any in the presentation on how many constituents that you primarily work with, what is available. I know that Mr. James and I had several conversations on the community level, on informing folks and just being a part of the events. But it would, for me, whenever I take on projects, whenever I talk with constituents, I always like to see data. It gives us a clear picture of our advocacy, who and where we need to be and who we need to talk to. And when you look at the healthline crisis, we know that there are certain epidemics occurring. Some obviously start small, and next to know they're right before us. And so it's pretty wise to remain proactive. So that was primarily my main question. Both the Care First as well as Western Sky on the data, on its representation with Navajo, the types of call, the types of services, the types of information that people are using when they're either qualified or applied to the programs that you get through. Thank you. That's back to you, Vice Chair.
Thank you, Mr. Nez, for those questions, and I'll go ahead and turn it over to you, presenters, to respond.
Thank you, Vice Chair and Vice Chair delegates. I'll defer to my colleagues from Arizona to answer the questions about 988.
Certainly, this is Amy Devens once again. So 988 is that national 3-digit number that the National Suicide Prevention Lifeline converted to and started to brand July 16th of 2022. So that's overseen at the federal government level, but it consists of multiple call centers throughout the United States. In Arizona specifically, that call center is Solari, who's also our contracted provider for all crisis line operations in the state of Arizona. There's a secondary, a smaller operation that's in the state of Arizona, not likely to get the call. So Solari would be that main hub. 988 always answers. If you are a veteran and you want specific veteran services, you can seek those out through that line. There could be a delay if for some reason you're calling from an area code on the cell phone that maybe is served out of Colorado. You may end up transferred to a call center in Colorado, but as soon as you articulate where you're at, they'll try their best to get you to the call center that is probably in closest proximity to where you're physically located. With regard to the 844 number that I mentioned, the 844-534-4673, the HOPE number, that is the state of Arizona's entire statewide crisis line. It does not matter where you're calling from. They always answer. You don't get queued. You can right away start talking to someone. If for some reason, you're saying, I'm calling on behalf of myself and I need some help. You can start that crisis intervention on the phone right away with that crisis specialist that's basically sitting there ready to start helping. That's also the way that you ask for someone to come out as well. If you don't want to talk to somebody on the phone and you're like, I want someone to come to me, here's where I'm located. They are the ones that will dispatch a mobile team out to your location. That's also why I mentioned, kind of leads into the co-location idea, because we do serve many areas that are metropolitan. We serve many areas that are rural and frontier. And one of the ways that we do that effectively is to seek out our partnerships where we can co-locate our crisis mobile team so that they have a shorter drive time to those places where they're trying to get to. We do oftentimes work very closely with our law enforcement partners. Like I said, many of us are former law enforcement, former firefighters, and veterans ourselves. So we do partner very closely with trying to get to different locations. We certainly don't ever expect our law enforcement partners to do the work of crisis. If anything, we're trying to be a safety net and take some of that burden off of our first responders.
Madam Vice Chair, in relation to the other questions, I'll take those. As far as the care for elders and our self-directed programs, I would share your concerns. We have a lot of elders that are kind of getting lost in the cracks when it comes to understanding and navigating through the Medicaid and Medicare systems, let alone the Indian Health Service. And so what I'll say is our programs operate as kind of an oversight to a lot of those providers. And so if you have a Native American member who's an elder that is in our program, we're actually doing the oversighting on those organizations, providing the care, the transportation, the in-home attendant, and hiring those individuals to come into the homes. Now, if they are not our members, then they are subject to working directly with those organizations. And that's unfortunately where we start to see them falling through those gaps. And so managed care is just that. We manage the care of the member through these programs. We work in oversight and we pay those programs directly. So in the Medicaid program, an elder should never receive a bill for receiving these types of services. But they do have to be enrolled in Medicaid, okay? And so that's very important to understand the difference there. We also manage those transportation services as well. So both on the New Mexico side and the Arizona side, we have what's called non-emergency medical transportation companies. We have a vendor on New Mexico side that's called Secure that works directly with a lot of those local non-emergency transportation companies that actually do the transportation. And so again, if they're our member, we work directly with these organizations to make sure the member gets that service and understands what it means to be transported to and from their doctor's appointments back to the home. And they do come on reservation. So there should never ever be an issue where a member misses an appointment because the company doesn't come on reservation. That is not the case within our organization. And Delegate Nez, to your question about data sharing, we are perfectly willing to share data with the Navajo Council and your organizations. We cannot provide specific member data. So personal information, personal identifiers, following along with HIPAA information. We can provide general information about access to services, types of services being provided, provided that it cannot, provided in that data that you cannot identify a specific member of a specific community. And in Native American communities, sometimes those numbers that we serve get so small that if we do identify a single person in a community with a health issue, we actually cannot report that because of HIPAA concerns. And so I just want to make sure that you understand the limitations in our data sharing capabilities, but we're happy to share any information. But please reach out to any one of us and we can provide that resource. Thank you.
Thank you. Yes, thank you for that response. Do I have a question from Ms. Helena Nez? Begay?
Oh. I have questions. I work with a senior center for 20+ years. And we have companies that come in like just what you're presenting right now. And all of a sudden, you know, we have elders that switch over, we help them switch over. And then they don't last that long. And then and nobody tells them that they're no longer in business. And they run around for that again. And so that's where, you know, it makes me wonder, you know, looking at you guys that you guys can be there for a long time. Because I've seen it. And I work with my elders that way. And a lot of them, you switch them over, you help them. And all of a sudden they just leave without notifying their clients. And then all the promises are made to them, you know, it's like, us Navajos, we like to, take it in and then all of a sudden, they just drop us. So that's just where I'm at. And then another thing we're talking about transportation is that yesterday on my way back from Twin Arrows, I stopped by to get something to eat and I got out of my car and I was walking in and, that safe right driver was sitting in the van on this cell phone. And, the poor elderly was trying to bend down because he dropped something, his bag on the floor, on the ground, and he was trying to pick it up. So I went over there and helped him. And I looked at the driver and he's so busy with his cell phone. And I knocked on the window and he says, "Aren't you getting paid for your client?" I go, and he looked at me and he just like, "Well, this is where they told me to deliver him. That's all I'm doing." And I'm like, but I says, "You guys are getting his money." I said, "You should get out of the vehicle, help him out of the ride." And I said, he was trying to bend down for the last, ever since I started walking from my car to here, he was trying to pick up his bag. Things like that, we need to really pay attention to who we contract with. And maybe let them know that you stand strong for them to really, provide services where it should be ended. And another thing that I noticed being at the cleanup site is that a lot of information is given out on Medicare. I know you guys, once you start enrolling, I know you guys gonna be taking is it Medicaid or is it Medicare? Or is it, I know I heard you guys from New Mexico and Arizona is different. And I live in Arizona. And my 5 region is in Arizona. So I kind of like how these guys presented theirs. But Arizona is more like what I've heard before from other resources. But they never really come down to our level. I've seen it too. So, when you guys do present something like this from the Navajo people, if you're going to go out of business or whatever, make sure you let them know. Because I've been there too many times. And we've seen a lot of people, we invite them to our senior center. We present it to our elderlies, even at their agency, elderly fest and things like that, and I invited them in and they did the same thing, and then they don't last that long. And for access, everything goes with access. Everything goes with access, I know that. And we provide all this information. They have to get this service, I know they have to have access, right? See, I know that they have to have access to get the service because all those other businesses were like that too. So we provide all these confidential information and all of a sudden it just, and then it makes me think, what did they do? I hope they shredded all those information. That's just where I'm coming from. I've seen it, I've done that, and I just don't want to just promise our Navajo elderlies. I know it's elderlies are the main target here because they're the ones that are on access and Medicaid. So that's just my question is, how long are you guys going to be here? Is it something for long term or traditional development? A lot of our Navajo young people, they like to go to sweat lodge. They do their counseling in sweat lodge. Some of them helps them. So And, I don't know, you guys didn't say not much about traditional like these guys did with Arizona, so. So that's why my question would be too. All right, that's it. Thank you.
Thank you, Madam Chair. Council
Yeah,
Delegate.
Hold on.
No.
So thank you, Ms. Helena Nesbegay. I appreciate your questions and your advocacy. I'm gonna hand this over right now to Chair, Mr. Dr. Andy Naz, the gavel for a few minutes, as I would like to ask a few questions as well. Ashiko, Mr. Nez,
Oh, I'll be.
Hagoshi. So let the record reflect that I'm giving over the gavel to Mr. Nez while I pose my question. So to the members of Western Sky Community Care, I'll just make mine's really brief. You mentioned your crisis service, and I believe that is a service that is just really needed throughout our reservation. And I feel like I'm not, I'm coming from the mental behavioral health field, and I've not, as a community member, in a rural community, I have not heard of your service. And years back, I did a lot of really good work with NARBA, Northern Arizona Regional Behavioral Health Authority, while they were in Flagstaff under Patrice Post. And we did some amazing community work. And at the time, suicide was really becoming an epidemic. And we did, some great programming as well as conferences. And that was a real critical time. And they really help us on the Navajo Nation lead some real critical discussions, because as the Net people, initially we had a hard time talking about suicide. And those of us with, traditional backgrounds and upbringing, it was real difficult, for us in trying to figure out how we are going to talk about it with our community people, as providers, as helpers. And it's something that we don't talk about. And I remember that NARBA was extremely instrumental in leading those first discussions with us, with a couple of us, really mental behavioral health folks in at the time. And so it was really critical time. And I think, gaining the knowledge and how we're going to translate that into our own language so we can talk about it back out here at the Hogan level, so that we're not scaring people. And also caring, really taking care of ourselves, because this was, a topic that wasn't easy to talk about. And so that time NARBA was extremely instrumental and we hosted a couple really big conferences in Flagstaff that were very well attended. And that was kind of like the how we had to begin, because then slowly we started to talk about it. And that's how then, those discussions led on to our Navajo, our Dene lands. So it was really important how that happened. And so I really appreciate that. And I think, if those services, and how come, I'm not hearing very much about your crisis services out here in these rural parts. And because, we're still trying to get through COVID. There are many who speculate that we're going to really, we're going to get into a mental health, crisis here, because of all the loss that we've dealt with COVID. And, there's going to be an epidemic of mental health. And so we need to be ready for that. And I can already see it here within our communities. And so how will you, provide and create that outreach out here into our rural communities? And I heard Department of Social Service say that, they really do need some kind of, even with their, in their own department, they do need a 24-hour crisis line because, where their office is only open from 8 through 5, Monday through Friday. But as you and I know, crisis doesn't happen between 8 and 5, Monday through Friday. It happens after hours and it happens on weekends. And so I'm going to encourage you to really meet with Mr. Thomas Cody with Department of Social Services, because I believe he could really use your, outreach with the crisis line. And at least it'll be one more place that some folks can call. And right now our, 911 police department are inundated, and sometimes police departments are not equipped to deal with a mental health crisis. And so, that. So I would just ask about, and those are just my questions and my comments to your presentation. Again, just really getting out to the communities, and that'll be it. Thank you.
Thank you, Vice Chair, for your comments as well as your questions. Before I give it back to our agents here, I call upon my colleagues on HES if there are any additional questions or comments. Delegate Toll.
Again, when has a committee, so Vice Chair, thank you. You didn't answer the question I asked in regards to tradition. Since you mentioned tradition here in the topic, I asked, how do you help the client? And that needs to be explained. I think this committee has a lot of concern on these care providers that come into the reservation. There's no regulation, there's no accountability, there's no monitoring. Who monitors all that? Because our elders are the main one are being mistreated and just like most of us Sunday elders get abused, and these caregivers, they don't help their elders. They go to their house, they might just sleep and clean and leave. Just between 8 and 5. So I think this body is going to have to really look into it, see if we can have, legislation in place to have all these caregivers that comes up to the res to be approved by the nation. Right now, any organization can come in and pick our elders. That's the concern I have. Nobody keeps track of all these caregivers company that come out. And then the other thing is our elderly needs a good in Navajo to explain Medicare and Medicaid. What is for? It's been missed. Nobody hasn't done it. I guess we have to ask the health department to do that. So the reason why I'm saying that is before the pandemic, I was the Navajo Council on Aging. We used to have members from each agency, 5 agencies, 2 members. We used to meet monthly and talk about these problems. We go out to their areas and do presentation, and that's what needs to start. Right now, if I sent you to way out Little Mountain, Big Mountain, Mount on, how can you explain and educate our people? We trust our young kids to go back and come back and interpret with their family. They're not doing that. All we do is let us, so I hate to say this, and the company that comes in, they abuse our elderly, take money from them. They're not telling the truth. So, I'm very disappointed, because if it wasn't for elderlies, my son brought she, we wouldn't be here. I wouldn't be here. I came through a hardship, I tell you. Took care of my mom's land, sheep. While they're having baby, I have to spend it at the sheep pen inside the courthouse. Now you can't do that to the kids. You're gonna call police, right? So it out the sheep, down to the how I was raised, even now, I really care for elderlies. Elderlies, families, young kids. So those, I think, the HEHSC committee can look into it and probably do. Because there's a lot of abuse going on. And I don't know. So, that chair, Madam Chair, Vice, that's all I have, and then, thank you.
Thank you, Honorable Toad, for the comments and questions and reiterating that. Honorable Nesbigay, Vice Chair Simonson, I will go to Honorable Nesbigay before I return back to our agents.
Oh, and I really appreciative that you all came in and to present this to us. I wish to like Honorable Toad said that more of these companies need to do what we're doing. That way, we can address issues and. Yes, I've seen it, I've seen that on the site. Honorable Toad is talking about. I address those too, but sometimes it doesn't get up to the main person. So, thank you. That's all I wanted to say.
Our agents for response.
Thank you, Mr. Chair, and also members of the committee. Mr. Toth, audit, 19 could be hadid the nedasa adnik a chin he caught over the caught not chan hid the ninigi Niki kodo bahunosiniki a host doka hotso yo toka hotso a boy has on guest hither. Other a yot forge a other a banana bar the yagi needs other host dodge host dodge access. No, your toka hotso a medicate or even in Chicago. Your toka hotso by yashki a in the behasti value added benefits if then he yagi Western Sky pahat at ego jo a traditional healing benefit if a kodo a not sauce but in check card if visa check card a not kidneys not being double ash like being basil or connect now a back a cut nasal I see kodo hatli Bashido hiki a donate then ha the hahantana has on antique esti benina. I do not add the neck of that a which is yago quite not sausage and a theatre had it are a base of cheese in but it did nitiki ado up at dassy other it has on it of done with neco a day out not a days war. I don't be 1,000 and it's go as a has argo so a quite one Muslim nas net a arch a chin than lingi a squido sign the lingi a not jaco. Aroshima added the Heinz add that for not this day non-emergency medical transport shop number that has not the age which is Nihin he the net a put zago but not this day but only not a secure transport if a keep with in English a non-emergency medical transport if not Mr. Chair, I'm going to yield my time over to our sister organization to answer the questions about crisis service on the Arizona side.
Thank you, Zane. I'll start off with responding to Delegate Helena Nesbigay's questions regarding our longevity. We've been serving Southern Arizona as a regional behavioral health authority since 2005. And I've been with the organization myself since 2007. So we've had a long history in Arizona. We were just awarded the new contract for Northern Arizona in October of 2022 is when our new contract went to an effect. And that contract is for 7 years to serve as the Regional Behavioral Health Authority to provide crisis services as well as other services. So we'll be here for a while. And as long as we continue to be awarded the contract, we will stay, as long as we are able to. As far as persons that we deliver, that we offer services to, it is those that are Medicaid eligible, but it's all ages. So from birth to elders we serve. As far as traditional healing, like as Zane had mentioned, that's an extra funding pot that they utilize for that service. But we also have similar funding available, and if that's something that is expressed as a need for the Arizona side of the Navajo Nation, is something that we'll go back and take to our leadership and say, this is what was requested. How can we help and provide this type of service that they are requesting? And then also to also answer Vice Chair's questions related to crisis response and crisis services. Since I've been with the organization for so long, I did work with NARGO when I first started, and I'm very familiar with those suicide prevention initiatives and conferences that were held back then. Now that we are the REBA, we are hoping to do those similar things as well. And also, we know that crisis response services is new to this area because previous REBAs may not have had the resources to do it or had the experience as we have in the South, working with some of the larger rural reservations, like the Donalpan Nation and San Carlos Apache tribe. And so we're here ready and willing to take on this challenge of ensuring that these services are available for the reservation here, and working in partnership with the Navajo departments, like the Navajo Department of Health and the Navajo Nation Department of Behavioral Health Services. We have recently been in communication with Arsenio Charleston on future meetings to talk about the possibility of these services and responding to those communities. And when we get to the point where we need to do the community outreach, we're willing to do that too, to go to chapters and communities to provide this information to ensure that all the communities are aware of how to access this service, and also hearing from the community of what those challenges might be, so that we can respond and make any changes to our services to ensure that it meets the needs of this tribe and this reservation here. Yeah.
Thank you to our agents, Western Sky, First Arizona, First Care, sorry. To our colleagues now here on the Director of Nomination Test, are there any additional comments or questions?
Yes, Manon. Yeah, thank you, Mr. Chair, for 10 members of the Health and Safety Minister. I had one question. I was looking through the PowerPoint. The question I have is there a physical address in New Mexico as well as in Arizona that you have a physical address on the application? Thank you.
Thank you, Legislator Advisor, Ms. Benali, for the question. I'll go back to our agents.
Thank you. As far as a physical address on Navajo Nation, the answer would be no. We do not have a physical office on Navajo Nation, but that is not to say that we're not willing to co-locate or partner with an organization or to even add a location on Navajo Nation. In 2019, we'd actually tried to create a storefront operation in Shiprock at the, what is it called?
Navajo Nation Shopping Center Incorporated.
And that was right before COVID. And that development is still on the table. We'd love to put a physical location on Navajo Nation so that we can better serve members.
Great, thank you for the response. On queue, I have Honorable Curtis Yanito. Mr. Yanito. Second call, Mr. Yanito.
Good morning. Can you hear me? I have a question on the traditional healing. Is there a log or like a a report on who's all using it, or, you know, something like that. I think that needs to be reported, because I'm hearing a lot of these traditional healings with all these other hospitals or clinic facilities, and they mentioned those things, but I haven't hear a report back how the people are actually using the traditional healing. Can you provide some kind of information or report on that? And then that'll be my first question. My second question would be, you're covering Arizona and New Mexico. Do you go into Utah too? That'll be my second question, if you have.
Yeah, Chanela Delegate Yavito. And I open it again to my colleagues for follow-up or any additional questions or comments before I go back to our agents. Second call. But then I'll go back to our agents here.
Thank you, Vice Chair. Thank you for the question. As far as the traditional healing benefit, that is something that the way it is designed in New Mexico and as part of our contract with the state of New Mexico is that is meant as a benefit directly to members, not to providers. So it's not like a claim process you would have with when you're seeing a doctor or a behavioral health person. This is an individual request for an individual member to utilize. Now, once that member does make that request, we do not follow up. We do not provide any guidance or clarification on that member. The hope is that member is connecting to traditional medicine. It has to be vague and broad that way, because you're not just dealing with one tribe, you're dealing with multiple tribes, and the tribes themselves, we are respecting the sovereignty of those tribes and those tribal members to utilize that benefit as they see fit. So I know I have limited knowledge of the Navajo Nation's traditional healing benefit, or the traditional healing services available here. But as far as on the Pueblo side, we do not receive money in exchange for any traditional services. And so that's why it's meant as a reimbursement to members specifically, not to a specific provider. We do have data on how many members actually request the benefit and what tribe they're from. We do have that data. Of course, we cannot share personal information, but we can provide general information on how many individuals request that benefit, general location of where they are, what tribe they're from, and then the dollar amount that we spend on that per year. We can certainly provide that information upon request. Please just reach out to me and we can share that information. As far as services in Utah, we are primarily Medicaid and Medicare. I will have to double check. But as far as I know, we are not in Utah for Medicaid services. However, we may provide Marketplace through Ambetter Health or Medicare through WellCare services. And so we may not have a Medicaid presence in Utah, but we may have a Marketplace and Medicare presence there.
Great, thank you to our agents here at Western Sky, as well as CareFirst for the response there. And just as an FYI, the Honorable Curtis Vito does represent our chapters there in Utah. And I think we're always bringing Utah to the fore. It's important that we also acknowledge our Utah relatives. So I just wanted to make that comment. Going to Honorable Toll.
Oh, when I ask our attorney, question I have, ma'am, or can you do research for us that is there legislation in regards to these health providers from outside? They just come in and start doing services. Is there a way of protocols how they can be recognized and do services? Because from my point, they need to be accountable to the nation. And a lot of them just come in and they promise us that we're going to provide service, especially to our elders. There's such a legislation. I am aware of. I don't think we have any. So the last time I was with the Navajo Nation was 1995 to 2003. There was no legislation. But that's where I'm gonna ask, can you do research, see if there is such a legislation? Because they need to be accountable, because they're serving our nation. And how did they come in, who authorized for them to provide services? So I thought we're a solid nation. I question. So a lot of these complaints can be, be enforced. If we don't have it, I mean, they can take advantage of this. But I don't want to see that because our elders are being abused a lot. Don't care for it. I mean, that's my concern. So I don't know if there's any law. I just wanted to. I just wanted to ask that if you can provide or research. Thank you.
Vice Chair, this is Kristen Lowell with Legislative Council. If I may respond to Delegate Toll.
Yes, you may.
Thank you. So I'm not sure what the objective for Western Sky is. I'm not sure if they're looking to secure a contract with the Navajo Nation or if they're looking to provide services with entities that are on the Navajo Nation. But depending on what that objective is, that will shape my answer. As far as if there are legislation that regulates entities that provide healthcare benefits to people on the reservation, that would be something that the Department of Health would need to initiate. So I don't know if there's right now anything that regulates specifically healthcare entities, but that would, if there is to be legislation, that would come from the Department of Health. That would be basically the oversight. Chair.
Great, thank you. And just for the record, Ms. Kristen Lau is our attorney assigned to the Health, Education, and Human Services Committee. So thank you for the response. Delegate Tost.
Okay, so again, thank you all. I'm not saying that these some providers, some of the company that comes and do a good job, yeah. And just, like one or two that we need to look at and monitor. So, and then help if it's the responsibility, then it goes to the help. There should be monitoring. And that's all I need to say. So we'll do some research and see if we can contact the health department. Yeah, thank you.
Great, thank you, Delegate. Back to our legislative advisor.
Yes, Mr. Chair, members of the Health, Education, and Human Services Committee. What also might feel like the structure of this entity is to know if where you're incorporated, if you're incorporated in Arizona or New Mexico, or and with now with the Economic Development Office.
Okay, thank you to our legislative advisor. I'll take that as a question to our agents. So I'll allow you to.
Mr. Chair, Pro Tem, also members of the committee, Health, Education, Human Services Committee, I appreciate your question. And first of all, to Legislative Council, thank you for clarifying or asking for our intent. Our intent here today is just to give you information about who we are, the services that we provide. Western Sky do care first Nasi Ashi you huge shin our information is on our presentations as well. If you need further information, a more in-depth presentation, more in-depth discussion, that's what we're here for, is really to show to the Health, Education, Human Services the services that we do provide, that we are a resource to the Navajo people. And as far as being incorporated, Western Sky specifically, we're contracted with the state of New Mexico under Centennial Care. So we are contracted with the state of New Mexico. I'm not aware that we are incorporated with the Navajo Nation. but that is a good question. I don't know about Arizona.
Yes, on behalf of Care First for the Arizona side, we are incorporated in Arizona as well, and to answer Delegate Toll's question as far as Legislative Council's question as far as our objectives is to provide the information as a courtesy, and also to possibly pursue an MOU that would allow us to bring this new service, crisis services, onto the reservation and respond to crisis situations on the reservation in partnership with the Navajo Department of Health and Division of Behavioral Health Services as well.
Great, thank you for that response. Any final questions or comments from my colleagues on the 25th HESC committee? Second call. Okay, before I hand the gavel back to Vice Chair, I do want to offer an opportunity for 2 additional team members that I noticed came with you guys. If you can also just introduce yourself to the team, and afterwards I'll give the gavel back to our Vice Chair.
I am Allison Hefner. I work under Amy Devins. I am the first responder liaison for all of Navajo and Apache County. I've lived in Navajo County for 30 years, so I'm a local, and that's where I'm from.
Good afternoon, Lieutenant Chair, members of the committee, those that are online and those that are in attendance. My name is Alberto Pashukai. Adon and Shuni for the cheat, making on a budget chain. Not at a cup on that shadow for the country, that should never go for hot little shadow art for the country, on a sina shadow art, now for auto at the end of the and I served as alongside with Sheena as on the tribal service team as the tribal liaison, as we are part of the new REBA that has come to northern Arizona. So part of that, there's 5 counties, and then we do work with 11 tribes, including Navajo. So out of the 22 federally recognized tribes within the state, we do have half of them in northern Arizona, which we are working towards to implementing similar crisis services across the other 10 tribes. And we do have, I think, the Hopi Reservation is one that is currently active, Fort Mojave. We're also working to secure on the Qualified tribe as well next week. And then following that, we'll be working with the Supai. So the similar presentation that was provided today by our team is the same presentation that's going before those tribal councils and chairmen and chairwomen with those respective tribes. So thank you again, and thank you very much for that opportunity.
Thank you again, and for making the trip out here. Thank you for the presentation and your presence. And at this point, I'll give it back to our Vice Chair for the record to do a roll call vote to accept today's report. Again, Vice Chair, back to you.
Thank you, Mr. Andinez, for your help in that. Let's go, committee members, let's go ahead and go to a vote to accept this presentation. And once again, thank you to the company that has come out and shared information with us and to improve the health and well-being of our people throughout our communities. So if members of the committee, I'd like to go ahead and go to vote. Mr. Toth, how do you vote?
Green.
And Dr. Andinez, how do you vote? Miss Helena Nesbegay, how do you vote?
Green.
Mr. Curtis Yanito, how do you vote?
Green.
And Mr. Chair Vince James, how do you vote?
Delegate James votes green.
And thank you, committee members. And with that, we have five in agreement. Is that 5? Okay, yes, 5 in agreement. 0 opposed, 0 abstain, and chair not voting. So thank you, Western Sky, for your report. And committee members will go ahead, and you may be excused.
Thank you.
Thank you. Thank you. You've warmed up the seat for the next group. Well, actually, I think they're going to do online Zoom presentation. So, or unless somebody's here from Division of General Services, if you would like to come up to to the chairs, the presentation, the hot spot there. And next, committee members, we're moving on with our agenda. And with the changes that we made to the agenda amendments, Division of Social Service will be next here. And I believe you were on the line when we explained real briefly the format that we have for programs and divisions that are coming before us. And we have a format, and I believe you have a long PowerPoint presentation, but we're giving you 20 minutes for your presentation. So just, in your introduction, if you could just tell us how you're going to make that presentation. I don't know if it's just one presenter all the way through, or, you're going to share some time with others. And if you could provide that information to us, that would be helpful for us, so we know who we're hearing from. But thank you. And I'm going to go ahead and hand it over to Division of General Services. And you have 20 minutes. Thank you.
Thank you. Committee members, this is Shauna Vendel, the appointed Division Director for General Services. I have my staff, Mr. Marcus Yazzie, there in person. First of all, my apologies for not being there. I am currently on travel attending to potential initiatives for the current Niagara and Montoya administration. So my schedule is pre-planned about 3 weeks out. So my apologies, Shanan. It is probably 12 o'clock there. So again, good afternoon. I can start with the presentation real briefly, and then I can go switch over to Mr. Yazzie, who is our senior planner with the Division General Services. He is my delegated designee in my absence. But I can open up with the presentation for the Division of General Services. And then once we get down to the program specifics, I will have Mr. Yazzie do the entire presentation from that point. Just in the in saving of time, Kachi da Shinaldo Kilichi da Shiche, Ado Kintil Holiade in Asha Wide Ruins, Arizona, Ado Ad Ishiyaho, Ado Ati Eya Inash in Leho, Ado Ina Bedo Lina Losh Ati Eya da Hashtel, Do Ati Tonheshi, Do Chizo Atin Heshi, Ad Utaya, Kehonst in Leho, a coho di Bini Biona, Eya Nahaho, and then we were all online, patiently waiting. However, my brother's organization, Western Skies Community Group, happened to be there in person. So we are here to present. The Division of General Services is one of several divisions under the Navajo Nation. I hope my presentation is there available for you guys. We did email it out for the final review and presentation. Bonus slide number 2 is our overview of our organizational structure. I have 8 programs under the Division of General Services, Department of Information Technology, Employee Housing, Facility Maintenance, Facility Management or Facility Maintenance, Fleet Management, Insurance Services Department, Navajo Air Transportation, Navajo Nation Telecommunication Utilities, and Records Management. I also have a couple other programs under Insurance Services Department, Employee Benefits, Risk Management, Safety Loss Control, and Workers' Compensation. Going over to slide 3 is an overview of the Division of General Services organizational chart. I have 4 additional staff members. My deputy position is currently vacant. I do have my senior planner there, Mr. Marcus Yazzie, my ASO, Michelle Slinky, who does our personnel matters, is holding down the fort there at Admin 1. And then our office specialist, Ms. Minya Tallman, is there with Mr. Yazzie. The pay slide number 4 is a budget snapshot as of 3/28. You can see our current budget statuses. At the end is the percentage of expenditures for your review, Shanantai. Our strategic outlook for the entire division shows some short-term goals. 1 is employee housing survey. 2nd is a fleet management vehicle usage survey. 3rd is a cost comparison on outsourcing select services such as maintenance, our custodial programs, and our employee housing. Next is the expenditure of idle funds such as citizen dollars, ARPA, CARES Act dollars that are still sitting there waiting to be used. Building assessments, that's currently underway. American with Disabilities Act Compliance Project, that is currently underway. And then efficiency and effectiveness assessments for all 8 programs, which is currently underway as well. The strategic outlook for long-term is determining land availability in the Navajo Nation, and then plan, design, and fund new central office complex, plan, design, and fund new agency office complexes, plan, design, and fund new employee housing complexes, and then amend plan of operations for facility maintenance, converting them to facility management, and then employee housing merging with facilities management department, and then NNTU merging that with facilities management department. It should also be noted that the executive branch strategic plan will be completed by April 23rd, at which time we should have a complete and solid outlook for the Division of General Services. At this point, I'd like to turn over to Marcus Yazzie for quick summaries on the programs. Mr. Yazzie?
All right,
Air transport.
all right, thank you, Sean. Good afternoon, everyone. My name is Marcus Yazzie. I'm currently serving as the senior planner and delegated to oversee Navajo air transportation as well. So let me go ahead and continue with slide 7. Navajo air transportation. I do have my additional staff listed there. Minia Talaman, which is a senior office specialist for DGS. Michelle Slinky, she's the ASO for DGS as well. And we're also overseeing the operations of now air transportation at this time. So air transportation currently has 4 positions, permanent positions, which is the air transportation director, the senior office specialist, the aircraft pilot, the maintenance technician pilot. At this time, the administrative assistant position is currently pending a PCQ reclassification. And there's also 3 temporaries assisting with Navajo air transportation, which is a maintenance technician, labor, and office aide. The SOS was advertised with DPM. We're waiting for the QAs to come back from them, and we're going to go ahead and schedule a hire. Moving on to the next slide, number 9, which is the program summary. Navajo air transportation's purpose is to provide a safe and cost-efficient air charter services, and which manages the following sections within its program, which is the administration, the flight operation, safety, aircraft maintenance, and training. Some of the challenges that faces the programs are personnel issues. There was only 1 staff that was at the airport when I joined DGS. Right now, we're currently facing rodent issues, infrastructure repair, their funding as well, and we're working to be FAA compliant, which is the Federal Aviation Administration. The solution timeline for this, hold on really quick. All right, the solution timeline is the positions are being advertised. There is a pending qualification, like I stated. We would need to conduct a building assessment on the facilities at the airport, and also reviewing the FAA handbook and website. Agency challenges with the Navajo Nation, challenges is funding, vacancies, and procurement process. Currently, there's no funding or there's no relationship with the federal government. And with the states, Arizona, New Mexico, and Utah, there's currently no challenges, but from my point of view, we would need to research the aviation grants to see if they have any funding there with their agencies. 4 of the goals for Navajo air transportation is to hire the senior office specialist position, to complete the advertisement of the administrative assistant program, to complete the perimeter fence program, and also to complete the request for proposals for the security cameras and upgrade the airport terminal access system. Some of the accomplishments that were completed with the HVAC system was replaced. We did procure Black Creek Fencing Company to upgrade the perimeter fencing. The sweeper is now operational and it was repaired. So now the runway is clear of any debris. And we currently completed the engine for King Air 200 plane. We would need to begin the process on the engine overhaul. All right, so continuing on to slide 12, Department of Information Technology. Royetta Whitty is the Director of Information Technology. The next, I believe on her delegation is Alex Largy. He is the Network Manager. So the program summary, challenges and timeline and solutions for DIT. The administration section is responsible for the administration aspects for the department. The desktop section is responsible for installing and maintaining PCs and its peripheral for the Navajo Nation government, as well as the help desk administration. The network section is responsible for maintaining the network servers, network connections, and internet services for the Navajo Nation government. The software support section is responsible for maintaining the MS SharePoint 2019 customized web services and SQL. Database administration for the Navajo Nation government, responsible for developing websites and web applications for the government as well. Some of the challenges that DIT faces is bandwidth, the IT solos, the cloud solutions, Microsoft 365, the cybersecurity authority and IT policies. The timeline for these challenges, I believe bandwidth is 1 to 3 months. Microsoft is 2 to 3 months. Cybersecurity is 1 to 6 months. Moving on to the next slide, slide 14, challenges DIT faces with the Navajo Nation, Federal, Arizona, New Mexico, and Utah is the internet and layer 2 bandwidth. The internet is 1 GBS.
Water, Chair. Vice Chair, point of order.
Yes, Mr. Toth, I am, you have a point of order?
I don't like this teleconference. We requested in person. I'd like to have the staff in person give us the report, not from especially division director. So if I'm in order, I would like to reschedule this. Need the division director to be in person and give us the report. Chair, Vice Chair.
Thank you for that, Mr. Toth. So at this point, Ms. Benali, are we, and Chair James, we're going to substitute motion to reschedule Department of General Services to a time that when he can present in person. Am I stating that correctly?
Madam Vice Chair, there's no motion or second at this point, so you can reschedule the report if the committee members wish to do so.
Okay. And do we need to get a consensus from our committee members for that?
Yes, that would be advisable. That way, for the record, the report has been deferred to the next meeting. Madam Vice Chair.
Okay. So there is a request to have the division director be here in person and to reschedule this presentation until such time that he can be come before the committee in person. And can I go around the room to see to hear whether you'd like to go ahead and halt this presentation until the director can come in person?
Vice Chair Delegate James here.
Go ahead, Mr. James.
I'll go ahead and make a substitute motion to reschedule the Department of General Service at a later date, working with Division Director Shauna Bendel. Thank you.
Okay.
Vice Chair.
Yes, go ahead, Mr. Ness.
I respect the motion, the substitute motion provided here by Chair James. I just want my colleagues to know that I do see that Jonathan is online. We also have 4 additional staff here. I'll be voting red on this. I think, we're here, everyone's present, and I just wanted to make that comment, but I do respect my colleagues here with their request to reschedule the BGS's presentation. But I just wanted to make that comment for the record. Thank you.
Okay. Thank you, Mr. Nez, for that. And I do have a second from Yanito to the substitute motion. So so we have Mr. Tolls, you motioned, and Yanito, you are in agreement. Miss Helena Nez Bigay, Nishihait Albansan case.
Vice Chair.
Okay. Vice Chair, let me give it back to Dr. Ness right here.
Okay.
Vice Chair, just for clarity on the record, it was Honorable Chair James that motion, seconded by Honorable Yanito.
Yes, thank you. Thank you, Mr. Nez.
Well,
And let's go ahead and go to vote. Mr. Tolls,
in favor, ma'am. Thank you.
Mr. Nez, Dr. Andy Nez. You're
Red.
red. Okay, and then we have Chair Vince James.
Delegate Jane vote screen.
Okay, and then we have a text that says, Mr. Curtis, you need to vote screen. Miss Helena Nez Bigay, how do you vote?
I vote green.
Okay, and there we have a request to have the division director come before HEHSC in person to present on general services. We have 4 in favor. We have a motion party and a second, and then we have 4 voting in favor. We have 1 not in favor and 0 abstain and chair not voting. And so with that, we will ask the Division of General Services to schedule a time to come when Mr. Shonovan Dale can come in person with his staff.
Vice Chair.
Yes, go ahead.
In the event that the information provided by my colleagues on having the party present, I don't see that our superintendent of schools is online, nor is Dr. Begay here at the conference. And in the event that we're setting precedents on having the agent lead here in person, if staff can make a request to DODIE to be present here at the event. Those are my comments. Thank you.
Yes, Dr. Andinez, and I definitely would agree with you on that. That if we are setting a precedence to say that the presenters are to be in person, then our next group coming up would be DODIE. And if we're, I don't know if Mr. Harold Begay, Dr. Harold Begay is physically present there, or any of his staff, and how we would like to proceed with that. Any other comments from committee members on that?
Vice Chair, Delegate Nez.
Go ahead.
If it's a consensus, I would like to request a 10-minute recess so that we're allowing DODIE to be here in person. And again, because Dr. Begay is not currently here at BNF, nor is he online as well. Thank you.
Well, we'll say one has to be here, then if he's not here, we get after him.
Yeah, we just can't, Chair, we just can't give individual time to, they're aware of it, to be here.
Yes,
We
we
just
do.
can't favor this. In order to be here and like, we couldn't research.
This agenda was sent out several days ago.
I would go to reschedule the education child there in person here at the on the floor, Madam Chair.
Okay, and so, and again, Ms. Benali, is that something that we proceed with another substitute motion, or can we, can you tell me how we do that?
Madam Vice Chair and members of the Health Education and Human Services Committee. If you take a 10-minute break, I'm sending an email out to Dr. Begay and his staff that to please be present and be in a conference and proceed with that report. If they don't show up, then yes, we would proceed with the same method of deferring this the report or orientation presentation from the Department of Education to the next meeting when the superintendent can be present. Madam Vice Chair.
Okay.
Vice,
Okay,
Vice
thank
Chair
you.
Delegate James. Delegate James here.
Go ahead, Mr. James.
Yeah, Shada, thank you for chairing the meeting, other members of the HEHSC committee, and then staff, and then audience. Yat Eho. Later, we had the understanding that this is orientation. Orientation, behanetzeho. The question dezik atako. Ado Nana, our staff, legislative advisor, Ms. Benali, emailed us on indicating orientation. They have enough notice. Ado ape kone shabiga tajino lato behada zito ishtan etaholia. Kote to nihitato najakata. Oshina, so just move on the agenda, just call them. If they're not in person, then just move on. If they show up, then you have that option to always go back to that item as well. It's orientation. They know what the meaning of orientation is. They're supposed to be there. They're supposed to present the information. Even yet orientation. If it was a different action or legislative action or something, besides legislative action, or if it was a report, but the orientation, oversights, orientate, that's the least committee members, has open yet hon G's town, the question needed down what about so what is that over this Shade Vice Chair Quadroli, thank you.
Oh, thank you, Chair Vince James. And as suggested, we can go into a 10-minute recess to see if Mr. Harold Begay, Dr. Harold Begay, can come to the committee meeting. Do we need to vote on that, or just a general agreement and consensus?
Madam Chair.
You can call that.
Go ahead, Mr. Toth.
A motion to reschedule the education. We don't need to give them time. Just like the chair said, they were informed ahead of time. So I motion to reschedule them. Motion issue.
Vice Chair, please delegate.
Oh, okay, go ahead, Dr. Andinez.
Thank you. The reason I have motion for a reset, because I do see several of their staff online, but because we had set precedent on the division director, the superintendent to be in person, that's why I called the motion. I called it because the intent, I think, was to hear DGS first, and being that they were rescheduled, I think that's why they were not here on time. But again, I respect the position of my colleagues on the tweet that has, but I just wanted to make that clarification on the reset that I had motioned on. Thank you.
Okay. So the question,
Madam
The
Chair,
question is,
Madam Chair, Vice Chair, this is Delegate Nancy Gay, and
Okay.
I'm gonna second Mr. Toth's motion.
okay, we have a second. So we have Mr. Toth, who is motioning to hear from DODIE until they can be in person, just as Department of General Services. And then we have Miss Helena Nesbegay with a second. And I'm going to go ahead and go to vote on this. Mr. Toth, how do you vote?
Motion green, sir, Madam.
And Dr. Andy Nes,
Red.
red? Okay. Mr. Vince James, how do you vote?
Delegate James votes green.
Okay, and we have a text from Mr. Curtis Unito with a green. Adam, Miss Helena Nesbegay, Nishehida.
I'll vote green.
Okay, so with that, committee members, we have a motion and a second before us to reschedule Department of Education with their lead, Dr. Harold Begay, to present in person before the next HEHSC committee to provide a thorough orientation for our members. And we have four in favor, 1 opposed, 0 abstain, and chair not voting. And then with that, committee members, my colleagues on HEHSC, we will move on to the next item on our agenda, which is old business. And at this point, at this time, we have none. And then the next one would be 7 is new business. And then at this time, we have none. And we are on to item 8, close of meetings. And that includes announcements, if there are any from our committee members. And then we will move into adjournment. And as you can see, we have next meetings listed there as well. HEHSC committee members, do you have any announcements to reflect on the record at this time? Going once and going twice. There seems to be no announcements from committee members at this time. And as you can see on your agenda, there are next meetings that are coming up. And if there is nothing else at this time, committee members, we move to adjourn this meeting. And if I may have a motion and a second for that.
Before motion there, Vice Chair,
Go ahead, Mr. Toth.
thank you, Chair, Vice Chair and members of HEHSC. I brought this issue before the committee last week in regards to kids detail to what was it, Wyoming? And I have not heard anything from the president or from Navajo Nation, the status of it. So I wanted to ask the legislature or attorney to look into it, see what the latest information, who's doing letter or phone calls. Thank you, Chair.
Oh, for some reason, Mr. Toth, your audio was really choppy on that one. Can you repeat that one more time?
Okay, Madam Chair, nice. The last 2 weeks ago, I brought this issue in regards to our kids being detailed to Wyoming by BIE. I want an update, see who is working on it. I know people, staff Pat Sandoval came before this committee that he was gonna work on it. We'd like to know what's the status. If anybody have, contact them. And I guess update report, that's what I'm asking for. Thank you.
Okay, thank you. I heard you very clear on that one. Oh, so the last meeting, we did talk, there was the issue brought up before us where some members of the Navajo Nation were reassigned to Wyoming for a temporary reassignment. And so with our Dene people reached out to us because they were concerned and they were not, they felt like they were not in a safe position with this new assignment. I did hear at the time that you had Mr. Chief of Staff, Mr. Sandoval in the room there with you, and that it would be something that they could perhaps do some research on and reach out to BIE to see how that could be addressed. I don't, so the concern is when do we revisit that and get an update report? And so we have some meetings coming up here. I don't know if we go ahead and include that at one of our upcoming meetings that are scheduled. Is there some solutions that other folks might want to chime in with? I don't know if our any of our legislative staff are online, because I know this was an issue. I know this was an issue of because one, they were not Navajo Nation employees, they're Bureau of Indian Education employees. That was something where we really couldn't, we have really no oversight to that. So I don't know if maybe somebody from the legislative side, the legal side might want to help us on how we can navigate that.
Madam Vice Chair, this is Anthony Ganelli.
Go ahead, Miss Benali.
Thank you. Let's try to plan on they are working on answer that became and the last meeting did invite, I had invited the director of the she did call into Zoom. However, we had to do the Zoom meeting at that time, and that was last Wednesday. And that's just for your information, but Ms. Pinto was responsive to our request for her to appear on Zoom. That's the extent of the information that I do have. I haven't received any emails. However, and I'm asking Ms. Kristen Lau if Dana is ready for after this meeting. Okay. It appears that the two legislative council is hasn't gotten materials together to meet with HES after the meeting has concluded. She's still in the process of compiling information, Madam Vice Chair.
Okay. Thank you for that, Ms. Benali. So it just sounds to me like we still need to reach out if we're going to get a report on what has been done. We have 2 meetings coming up. There's a special meeting. Well, not just 2, but there's several meetings, but beginning Monday. And I know that one's a joint meeting with LOC, but perhaps if to give the other folks time, maybe we can choose April 4th or 5th to include that on our on our agenda. And maybe at that time, somebody will have, we can reach out to Mr. Sandoval with executive branch to see what they've done, give us an update to see how they've followed up on it. As well as maybe Ms. Pinto, as you mentioned, and they could give us some insight to that. And so we can, I believe, as a committee can decide to put it on the agenda in one of our upcoming meetings. We can also, as we are getting ready for this other meeting, we can also post the same question to our legal counsel, Miss Barbroff, and perhaps she could give us and help us figure out how we address that concern. So we'll keep it at the forefront, Mr. Tolf. I'm not trying to brush it under the rug. We will get, we will have an opportunity to ask Dana here within our next meeting, Ms. Barbroff. And we will have an opportunity to ask her how we can address that. So with members of a HES committee, I'd like to go ahead and go and adjourn this meeting so we can get prepared for the next. And if I could have a motion and a second.
Motion to adjourn.
Oh, Mr. Tolf, the motion, do I have a second? Ms. Helena Nesbegay with a second. And let's go ahead and go to a vote. I'm going to start with Mr. Tolf. How do you vote?
I vote green.
Dr. Andy Nez, how do you vote?
Red.
Red. And Mr. Vince James, how do you vote?
Delegate James votes green.
Vote, Delegate James votes green. Mr. Curtis Unito votes green via text. Ms. Helena Nesbegay, how do you vote?
I vote green.
And Ms. Helena Nesbegay votes green. And there we have members of the HES committee. We have 4 in favor of adjourning. We have 1 not in favor, and we have 0 abstain and chair not voting. And with that, we will conclude this meeting at 12:40 p.m.
Thank you.
Thank you. Enjoy your lunch.
Sorry.